The V-Life with Dr. Annie is produced by Advanced Cardiovascular Care Center with educational grants from Amazing Lines and Dolce Vita Cardio Advanced Med Spa.
Many times patients will ask me, well, what is cardiovascular disease? Juliana, don't you think that our patients, they're pretty savvy now because they've been with us for a long time, but when they first come, they say, well, what is cardiovascular disease? So let's talk about the anatomy, right?
Yes.
The anatomy of the whole vascular system. The heart is the most important part of that vascular system. The heart is pumping all the blood, right? The heart sits in the chest. We know that. So the heart, when it pumps blood, there's systole and diastole, right? Systole is when the heart is pumping, diastole is when the heart is relaxing. And many times people have good pump function, but they don't have good relaxation. Maybe they have diabetes and they don't even know it, right? Maybe they have high blood pressure. So how do we check that? That's a great test that we do here in the office.
I know we want to explain to people that, you know, your heart is, like Dr. Varughese said, is the pump of your body. Just think about like, you know, an engine, and that has all this wiring. You know, you have your arteries, you have your veins, you have the nerve, and the nerve conduction. So we try to measure all this to see how efficient your pump can pump and how efficient your ways of bringing, you know, oxygen to your organs, how efficient that is. And you know, if you have anything that it would be like a blockage or deposits of plaque that could actually interfere with that flow of the oxygen to your organs all over your body. So yes, we do that. First of all, we like to do our cardiac ultrasounds, checking all these major arteries to see if there is any deposits of plaque. And Dr. Varughese is going to tell us a little bit about the plaque and how that is forming and what causes plaque formation. And we want to see if there is mild plaque, moderate, and how severe that plaque is already in your arteries. So we're doing carotid ultrasounds. We're starting from head to toe. We're doing carotid ultrasounds. We're measuring the flow in your major carotid arteries in your neck. And then we're going down to your aorta, which is the continuation into your trunk, into your abdomen. And we measure to see if there is no dilatation, if what kind of deposits and how much of plaque is there. And then we're going down to the legs and we're doing the lower extremity Doppler. And that's our first initial checking to see where you are and to where to start, you know, to treat you.
So the heart has pipes that come out of it, right? The carotid arteries going to the brain. So that's how we want to prevent stroke. And pipes that go down the big aorta, right, like you talked about, and the aorta branching into arteries to the legs. So you can see that the heart and the vascular system are the most important part of our body because we have to get blood flowing into all the organs to keep us alive and fit, right? So it's very important to know the anatomy. After we check the anatomy, then we have to know about the physiology. That's a big word, right? A lot of times in college or in high school, they're studying physiology and they don't like to study. That's a big word. But physiology just means how do things work in the body, right? So the physiology of the vascular system is really cool to understand, right? It's blood cells, right? Red blood cells, white blood cells, platelets, lots of different things in our blood. Remember I said the answer is in the blood, right? That's why you're living the V-Life, because you want to know the answer in the blood, the answer in the vascular system. So things can deposit in the blood, right? We have all our blood cells, but then what if we eat some fatty food? What happens?
So many things that happen actually in the blood, as Dr. Varughese was describing earlier, is that when you have a lot of fats in your blood, and you know your blood gets nervous, doesn't like to have a certain, that's why we're measuring in labs when we draw a certain percentage of fats or triglycerides or sugars, that if you exceed that percentage, that means that you are in danger to actually damage your endothelium, and which is the lining of the vessels,
the arteries, right?
The arteries. And if that starts to get damaged, think about again like that sink and your pipes. I always have that in my mind.
Oh, yeah.
Is because when you start to have these patches of rust, right, within your pipe, in your sink, what happens is the pipes can broke. Of course, deposits
And crack, right? Yes.
Exactly, and then you have all these deposits of fats, right, that you already put in that pipe.
Going in.
Exactly, go in and they start growing and start to deposit, and then your natural instinct, your immune system tries to repair that.
Right, it's the white blood cells, right? They become like the Pac-Man, and they start eating the fat. So what happens to the poor little white blood cell? Becomes bigger, full of fat, right? And becomes something called foam cells, right? So foam cells, they grow, and suddenly there's plaque in the lining of the vessel, above the lining of the vessel, and that plaque, what happens to it in a moment of crisis? Maybe there's something happened, some stress came into your life, or your blood pressure shot up. What would happen to that plaque?
It starts to erupt. It can broke, and then
Rupture.
it's a ruptured plaque, and that travels into your blood with your blood pressure, and it can stop onto the smaller artery, but it can stop, and that can cause
Heart attack,
heart
right?
attacks.
Heart attack, stroke. So we've had patients who come in, maybe they had a fatty meal, and suddenly they wake up at 2 o'clock in the morning because their blood pressure spiked, cracked the plaque, and they had a heart attack, right? So this is an easy thing to prevent. It's harder to fix the problem.
Yes, when you start understanding how that works, the prevention will be excellent and number one to really take care of your cardiovascular system. So,
what kind of symptoms would they have if they had a plaque rupture?
well, it depends on the person, but especially male, they have mostly like chest pains, like in the middle or in the back, or it radiates to their jaw. They have shortness of breath. They feel lethargic. They feel fatigue, sweaty. Yes.
Nausea.
Nausea.
Sometimes vomiting. Sometimes they don't have any symptoms except they just die. That's not good.
Yes.
So we want to prevent that, right?
But when you do prevention, you already know what your plaque burden is, and then you understand how to aggressively take care of that before you may be able to. Or you're gonna die like in a sudden death.
So we want to prevent that. And women, same symptoms, sometimes no symptoms, sometimes different symptoms. So it's really important. So that's why we're talking about this. We have some ways that you can learn how to prevent this problem, and we're going to talk about that soon. So you need to follow us, stay tuned, and please come back because we have lots of answers for life.
The V-Life with Dr. Annie is produced by Advanced Cardiovascular Care Center with educational grants from Amazing Lines and Dolce Vita Cardio Advanced Med Spa.